Hi guys, Dr. Robert Stevens here from the Men's Health Clinic. It's based in Poole, but however I'm in Marbella, Spain. The purpose of this video is just to give you a little bit of an insight into what service we offer and why we offer it. Now, I've been a medical doctor now for over 20 years and I've dedicated my career to addressing the issue of low testosterone and offering a bespoke medical service to optimize your androgen levels. Now, what does that mean? Essentially, that means that we are bringing your levels back to where they should be so that you can feel great. Now, is it as simple as saying, here you are, here's your protocol, go away, crack on, you'll be golden? Unfortunately not. The body's rather complicated. There is a titration process that you need to understand, that whilst we are very good at what we do, I cannot guarantee you optimization from day one. So you have to understand that your physiology changes and your physiology adapts. So I will work with you to help you achieve health, balance, stability, optimization, however you want to call it. It amounts to the same thing. You are designed by nature to be strong, to be able to procreate, and this is a wonderful world that we live in. You need to appreciate that you need to keep working at what you need to work at, which is nutrition, lifestyle, and exercise. And together we will get you to a place where hopefully you'll be very happy. As I said, I've been a medical doctor now for 20 years. This is a complicated field. It seems easy on the premise of you need to replace the testosterone and you need to replace the HCG, but it is far more complicated than that. So when you decide what route you want to take, the convenient route may not be the best route. The path of least resistance may not be the path that you should take for long-term stability, for long-term health. I say that because I know that. This is something that should be dealt with by doctors. This should be done by somebody who knows, whose passion is testosterone replacement therapy. This isn't something that you can dip in and out of. This is something that you need to dedicate your time and appreciate that the destination is not important. The journey is important. We offer a personalised service. So you will be dealing with me, Dr. Stevens, your clinician. All clinical matters will be dealt with by me. All clinical matters. Not by a salesperson, a mediator, a bro, a administrator. Clinical issues will be dealt with by me. Administrative issues will be dealt with by Lydia, because I'm useless at administration, as she will testify. So we should all stick to what we're good at. I'm good at medicine, so I'm going to stick to that. So choose wisely, guys.